I've seen children that show up without a helmet on and with a helmet on, and it's a drastic difference. The outcomes are different, more complex injuries, worse brain injury.
When you take that helmet off, you have nothing protecting your head. The slightest wreck, so, they were just going a couple miles an hour. But off of a four-wheeler, or say the four-wheeler rolls over on top of you, that's a big deal. For traumatic brain injury, the effects can be long-term. Some of the things that we commonly see is patients have flashbacks. They're out of school for a prolonged period of time because they can't be stimulated. They're outside of sports, and that's even with mild traumatic brain injury. As we get into the severe traumatic brain injuries, those can be even more prolonged, where this is life-changing potentially. Sometimes we have kids who are riding four-wheelers with friends and with siblings. They get hurt and there's nobody big enough around to help them get out from underneath of this ATV. So then they're waiting for family to arrive, waiting for help to arrive. And so then you look at the emotional impact of that, and it is truly life-altering for these kids. And then some of the patients with really bad head injuries that we've seen, they require lifelong support from breathing standpoint, tracheostomies, feeding tubes, and it can be very bad potentially. We have parents who are then strained, looking at resources from being stuck in the hospital to trying to get their child into a good rehab facility after discharge, changing their entire life from a care perspective post-discharge. Literally their entire life is different from the moment that they get on that four-wheeler until they end up here. They decided to go on a four-wheeler and cross the creek. And when they were crossing the creek, it was a very steep incline, which he did not have a helmet on at all. Whenever he was crossing the creek, he hit a tree root, which then caused the four-wheeler to flip back on him. When it flipped back on him, he flipped into the creek. So he had a broken nose, he had a broken jaw, he had a slight brain bleed, he had a little bit of a fracture on his eye socket, several broken ribs, and a collapsed lung. I was beyond scared. I didn't know if my son was gonna die. It was shocking. And then they told me everything that happened, and it was just traumatic. It really was. It was just heartbreaking.
I cannot feel it. It just left me in shock.
The brain bleed was one of the main focuses, as well as the broken jaw. They could either wire it or they could have left it be. And they said that it was very invasive. They said if it was their child, they would just leave it be and do a liquid diet for 6 weeks. Everybody at the PICU was amazing. They were right there. Anything and everything that he needed or I needed, they were amazing.
It changed me about me wearing helmets more and being more slow on the road.
I want people to understand that this is important, that children do need to wear helmets, not just children, even adults. Anything can happen to anyone. I've seen so many accidents that could have been prevented just from simple as wearing a helmet.
I'm not gonna lie, to begin with, years ago, not that I wasn't an advocate for it, but it was very hard to get the kids to wear helmets, especially my older ones. But after a couple of accidents and, cousin ended up having to come to the hospital and get 5 staples in his head, you really become to realize that it's a have-to thing, and it's really important, and it's something that we've really instilled, especially in the 2 younger ones, that they don't ride or get on a four-wheeler at all without having a helmet on. No matter what their experience level is, it doesn't take much to wreck the four-wheeler. It's really important that they wear their helmets and have them on right. If you don't have it on, you don't get to go. Don't settle for no. Make sure it's on tight to where right up underneath it can't slip up above the chin. And just pay attention and make sure that somebody's with them riding and they're not riding alone.
We're one of the highest states in the country that have children that ride ATVs. Part of our job as the trauma center is to provide that outreach, provide that education to help children not get injured.
All it takes is 20 seconds to put that helmet on your head before you let them get on that ATV. Or take the keys from them. Don't let them do it. Take away the ability to do it, and you can really, truly change your child's life.
I grew up riding ATVs. I've done it. And so I know what it's like to be a kid in West Virginia that rides an ATV.
Are ATV injuries preventable? I mean, I guess if you stay off of an ATV, is that realistic in our state? No, it's not. And I'm never going to tell someone, don't do it. I understand it's fun, but we just have to do it in a way that is safe, in a way that we know can help decrease the severity of an injury. Influencing children and educating children makes such a difference. These children will one day be adults who then can pass this message down to other children and other adults.